watching them? Was there anything that popped in your head that you would have done that they weren't doing?
The heart rate was going down quick.
Make you nervous?
Yes.
A little bit?
What would you have done?
I probably would have cried for a rapid response sooner.
It's okay. It's all about your comfort level, right?
Right.
Yep. And so, what is something that you could have done? I mean, if you were in that situation, and you really were worried about that, what might be something that you do?
Main rapid response.
The rapid response was already going on, but if you're standing there and you see that those changes are happening with the heart rate,
Say it, speak up.
Yeah, tell somebody it's rapid back.
because they might be so focused on that patient, they're not noticing it.
Or focus
And then-
on coughing and not.
Yep. Yep. And so John in that instance may have said, not that you have to call a code, but he knowing where the crash cart is on the floor, it's a jaunt from the room. He might have said, will you just go get the cart and put it outside the room? We do that all the time in the ICU. We call it warding off evil spirits.
Yeah.
That
Let's
might not
just
be
put
what you
the
need to do
combo
right then,
patches
but if that's
on
his
the
comfort
patient.
level.
just in case, then they're
Maybe
already
say,
on there,
sorry.
Good
ready to
idea.
go.
Yeah.
Start assembling your tools.
Yeah, just in case you need it, just in case, things change in a hurry. But when, Dr. Dana came, she was ordering a 12 lead, right? And that's good, that's what we want, because that's what we wanna see, is he, kind of vagueling down a little bit from all the coughing, or is there really something else going on? Is he in a block? Is there something that's really changed? That's good to know,
PE.
right? Yeah. What are some other things that you're thinking as you're standing there? I think it's much easier to watch than it is to be the one doing it. But
Yeah.
thank you for going
It's
first.
so much easier, honestly, it feels easier for me when there's a real person.
It does.
It's just the simulations,
Mhm.
sometimes it's like.
But
what
Heather
should
kills
I
it.
be
She
doing
sells
instead
it.
of
Well,
just-
like, no Oscar, huh?
You
But
always, like in these simulations, I feel
Yeah.
like you don't wanna say anything because you're working, you're going through it.
But this is the
So it's
perfect
a little
time
bit-
to do it, so like when you're having a thought,
Right.
like please share your thoughts, because that might be something that John uses in a scenario in the future, he doesn't work on the floor,
Yeah,
but
and that's a
he's
good
somebody
point
else
to bring
might.
up, I mean, really, cause, that's what it is, like, oh, okay.
Even in the OR, like I can tell you down there's 2 crash carts, there is so many rooms down there. A lot, they might choose to, oh, it's a little shady here, what's going on. Somebody out there without you even knowing might, the person who's running the desk, which essentially is like their charge nurse,
Yeah.
maybe they scooch the cart a little bit closer to that room so that
Sure.
it's close, without causing a panic, without calling a code. That just might be something they do. What else, if you had, people and you have bodies, what is something that you could have assigned to somebody to do? Especially when we were looking for the family. Who would be the perfect person to go find the family?
The spiritual care person.
If they don't have to respond to rapid response, but you certainly could delegate, hey, would you page the spiritual care person? I wanna have them, help us out with the family here. Cause can you guys leave to go get the family?
No.
Probably not. Yeah, so,
Be busy.
yeah, something else we can do. Any other thoughts on that? You did a quick intervention for rapid response, which is right. As soon as you saw, started changing, you're like, okay, calling rapid response. Good, perfect. No, that's good. Why wait? It's gonna take them a few minutes to
Because
get
you
there.
have to call them anyway, and,
It's gonna take them a few minutes.
yeah, I would rather call them sooner than later.
For sure.
So in an emergency like that, you're okay to go with
Yep.
Elevated O2 therapy.
There's actually,
Without an order?
a protocol that goes with rapid response.
Okay.
That kind of gives you a little bit of leeway, especially when the, either the ED or the ICU nurse comes. They have protocols to follow, and things that are covered, but yes, you're not gonna get faulted, in that situation where it's clearly warranted.
You see your
What would be
patients.
bad is if you had a simple mask on them at,
4 liters spent.
Right.
Yeah, right.
we don't wanna see that.
No,
If you're escalating and stepping up care, just make sure you're doing it properly.
okay.
Next scenario, this time you guys will watch, you'll be the team, and same thing, since this works out perfect, paramedic, nurse, tech, right? Fantastic, all right, let's do it again.